Mechanisms of PTSD. Firstly, we'll talk about the endocrine system mechanisms. The HPA axis, which is made up of the hypothalamus, the pituitary gland, and the adrenal cortex, is the main stress response system used by the brain. On a normal person, when stress is induced, the hypothalamus will secrete CRH, a chemical messenger, to the anterior pituitary gland. This will then release a chemical messenger ACTH through the bloodstream to the adrenal gland, where it stimulates cortisol. Cortisol increases physiological stress response, commonly known as the flight or fight response. In a PTSD patient, there is an overuse of the axis, causing an increase in glucocorticoid levels in the hippocampus. This will lead to a neuron damage in the area, specifically to the dendrites. This causes an increase in negative feedback response to the HPA axis. Neurotransmitter mechanisms. Norepinephrine, NE, is a principal mediator of the autonomic stress response that prepares the body for flight or fight. Hyperactivity in the brain causes PTSD patients to have an increased affinity for NE, leading to a stress response being activated at an extremely high level. Serotonin inhibits the fight or flight response by innervating at the amygdala. PTSD patients have decreased density in the serotonin reuptake sites. No serotonin equals greater effect of NE, causing hostility, aggression, and depression. Brain structure mechanisms. There is a decrease in hippocampal volume due to neuronal loss. This is shown to lead to a greater chance of false prognosis of danger. Furthermore, the medial prefrontal cortex similarly also goes through a decrease in volume. PTSD patients have shown hyperactivity of the amygdala. A part of the limbic system, the amygdala is involved in emotional processing, and with hyperactivity will lead to erratic fear responses and conditioning when recalling specific memories.